Right-sided colon cancer with liver metastasis. Let's talk modern management, step by step. Welcome back, everyone. Today, we're diving deep into the world of right-sided colon cancer, especially when it's spread to the liver, a situation doctors call metastatic, or stage IV. Now, don't let the technical terms scare you off. We're going to break this down together, just like we do every week. So, what happens when someone's diagnosed with right-sided colon cancer that's already shown up in the liver? Let's walk through it. Step 1. How do docs figure out what's going on? First up is the full workup. Colonoscopy with biopsy. Gotta be sure it's colon cancer. Imaging is huge. CT scans of the chest, abdomen, and pelvis check both the colon and those liver spots. MRI of the liver? Even better for picking up smaller lesions. Sometimes, they'll throw in a PET CT if the results aren't clear. Next, molecular testing. Do the cancer cells have RAS or BRAF mutations? This matters for targeted medicines later on. They also check for MSI, microsatellite instability, and dMMR, deficient DNA mismatch repair status. If you've ever heard about immunotherapy, this is why. And of course, CEA blood levels to track progress. Step 2. The main treatments. Can we go for a cure? Alright, here's where it gets interesting. The team, think surgeons, oncologists, radiology, all hands on deck, has to decide, is the liver disease resectable? In other words, can they remove all the cancer with surgery? If surgery is possible, and that's the goal, the plan aims for a full cure. Sometimes, if the liver and colon both need surgery, they decide which to remove first based on your symptoms. If the colon isn't causing trouble, they might tackle the liver first after some chemo. If it is causing issues like bleeding, that's first up. For the liver, if it's doable, they'll remove the tumors. Or, if they're small and not easy to cut out, use ablation. Think radio waves or microwaves to fry them off. Sometimes, they prep by blocking blood flow to part of the liver to help it regrow before surgery. And don't forget systemic, whole body chemo. 3-4 cycles before surgery, to shrink things, then more after, to make 6 months in total. For really tricky cases, lots of liver tumors, there are multi-step surgeries like ALPPS, associating liver partition and portal vein ligation for staged hepatectomy. If surgery isn't possible yet, it's all about control and quality of life. Here, the docs turn to chemotherapy with fancy combinations. Most patients get a doublet, like FOLFOX, Capex, or FOLFIRI, plus a targeted drug. Which one? It depends on those molecular tests we mentioned. RAS-RAF mutation? Go with bevacizumab. Anti-VEGF. No mutations? Anti-EGFR agents like cetuximab or panitumumab are in play. If the patient is strong and the cancer is aggressive, they might try a triplet combo, FOLFOXIRI plus bevacizumab. If the chemo shrinks the liver tumors enough, surgery could still be back on the table. Awesome, right? For folks whose cancer can't be cut out, there are more tricks. Radioembolization. Y90 beads straight into the liver. TACI. Chemo right into the artery, or SBRT precise. Radiation. Molecular testing pays off again. If the cancer is MSI high or dMMR, immunotherapy, like pembrolizumab or nivolumab, can work wonders. And for BRAF V600E mutations, there's a new combo, encorafenib plus cetuximab, sometimes with binimetinib. That's the breakwater regimen. Step 3. Don't forget supportive care. This journey can be tough. Managing pain with meds or nerve blocks, stenting the bile ducts if there's jaundice, and making sure your nutrition is on point are all crucial pieces. What about prognosis? If the cancers can be fully removed, 5-year survival rates are around 40 to 50%. That's real hope. If not, with modern chemo and targeted therapies, folks are living 2 to 3 years, sometimes more. And thanks to immunotherapy, MSIH tumors are seeing longer and better responses than ever. Key takeaways. Let's recap. Aggressive surgery plus chemo can mean cure for some. Don't give up hope. Personalized therapy is key. Know those molecular results. Immunotherapy is a game changer for the right patient group. This is always a team approach. Your case should be discussed at a tumor board with all the experts. That's it for today's deep dive. Like, subscribe, and drop your questions in the comments. Let's keep learning together. See you next episode.